All right, so for this question, we have a 29-year-old woman presents to the clinic because of increasing swelling around her ankles and lower back for the past 3 weeks. She reports that her eyelids appear puffy when she wakes up in the morning, but the facial swelling improves as the day goes on. She has no shortness of breath, chest pain, or abdominal discomfort. She has no history of liver disease or cardiac disease and takes no medication. Vital signs are within normal limits. Physical examination reveals bilateral pitting edema of the lower extremities and mild sacral edema. Heart and lung examinations are unremarkable. Laboratory studies show serum albumin at 2.1, prothrombin time, which is normal, serum creatinine normal. Which of the following mechanisms most directly explains this patient's edema? All right, so we're talking about edema. There are a few things that can cause it. A big thing will be a decrease in oncotic pressure. Pressure, right? And that should tell you that there's an issue with albumin, right? So if you see here, the albumin in this patient is low, right? Because the normal one is about 3.5 to 5, right? Or 5.5, depending on where you look, okay? So now you just have to figure out what is causing the low albumin. So it can be as a result of a decrease in production or an increase in excretion, right? So through the urine. Now, if you look at the prothrombin time, you can see that's normal. Now, you know that the liver produces both albumin and the clotting factors. So if the clotting factors are great, which is leading to a normal prothrombin time, that means it's not really a production issue. So production is out, and so that leaves excretion. Now, you can look at the serum creatinine and think, oh, it's normal, so there might not be any issue with the kidneys. But in nephrotic syndrome, which is what this is, you can actually see normal creatinine levels sometimes, especially during the beginning when there's no serious damage to the kidney, all right? Like a minimal change disease, something like that. So now you know it's an excretion issue. So that'll make the answer D, right? So reduce plasma oncotic pressure from urinary protein loss, right? Now let's look at the other options. A, impaired venous return due to valve incompetence. So they're really talking about varicose veins here, right? So remember that the veins have these valves. So as muscles contract, it pushes the blood upwards towards the heart, and then the valves make sure that there's no backflow. It's a simplistic way of looking at it, but it works. Okay, so if the valves fail, right? So for instance, let's do it this way. If the first valve is all right, but then the second valve completely fails on you, right? You're going to have a ton of blood in this area, which is going to increase hydrostatic pressure and basically force fluid into the interstitial space. All right, so that's wrong. B, decreased hepatic synthesis of albumin. We just talked about it. Since prothrombin time is normal, that means clotting factors are being produced, which means most likely albumin is being produced fine. So that means this is not the answer. C, increased capillary permeability from infection. You really see this in something like cellulitis, which you know is going to be unilateral, right? It's going to be like on one leg. So cellulitis. So there's going to be a ton of pain. There can be some fever, right? And obviously you can see that's red, that kind of thing. E, right ventricular failure causing systemic venous congestion. So if you do have right-sided heart failure, you're going to end up with jugular venous distension, so JVD. All right, and it's not really going to affect albumin levels either. I have lymphatic obstruction from soft tissue inflammation. All right, so this also is going to most likely be unilateral. You're not going to see any effects on albumin. Now, as an aside, one thing they really love asking is, for instance, what is something that's elevated in blood in nephrotic syndrome, which this patient has, as we mentioned. Okay? So it's going to be lipids. So you're going to end up with hyperlipidemia. So this is sort of just going off a tangent here. So hyperlipidemia. So just remember that if you have nephrotic syndrome, there's a good chance that there's going to be elevation in lipid content in blood. All right, see you in the next one.